Hey friends, the next interview we have is with one of the top perinatal chiropractors in Savannah, Dr. Kaleb with Restoration Chiropractic. I can't wait for you guys to listen to the interview and leave a comment with any questions or just letting us know what you think. Dr. Kaleb. So he is here with us. He is the owner and founder of Restoration Chiropractic, and I'm so glad that you're here.
Thanks so much. I'm happy to be on. Our whole thing here is uh, community and helping the community. We do our care here that we'll get into, but even more so than that, we like to just be a place of I know I already said community, but community and education and just helping families in our area.
Wonderful, wonderful. So, first, because everybody does not know you, I would love if you could give a little introduction and tell us a little bit about yourself and what inspired you to the specialty that you have.
Yeah, so I was an athlete growing up, and I did Olympic Taekwondo and a few different martial arts, and fought at a decently high level around the world, Korea, Olympic Training Center. I lived there for a little bit. Did a lot of high-end athletic things where I got a scholarship to my first year of undergrad, was on a couple of their teams, and basically lived in a gym. And so at that point in my life, I'd already decided that I was going to be a chiropractor, and we could talk about that at a different time if you want, how I decided that. But I was going to be a sports chiropractor because that was my main experience in life. And so I went to undergrad, finished my undergrad, and got into Life University up in Atlanta, was the president of the Sports Chiropractic Club, and we did a lot of stuff. We went to the what's it called? The NFL Combine. Got to
Wow.
meet all the other pro sport, the pro NFL chiropractor, team chiropractors, because most people don't know this, but every NFL team, every MLB team, all of the Olympic teams, they all have their own chiropractor. And so the Olympic team itself has its own chiropractor, and then subsequent teams have they all want to be operating at peak performance. And so that's what I was going to be with my life. I had already gotten in during my undergrad. I was working with the Falcons, the Phillies, and the Eagles, a lot of their players. And it was really cool. And I like to use the word cool. It was really cool. I felt really cool. It was, I was hanging out with these pro bowlers and, working with them. All these names that you know from TV that I can't really say all their names, but and I just thought I was cool, and this was cool. And there was some drawbacks to it. These players, we are charging them, sometimes three, four, $700 an hour, depending on how many people are working with them. And sometimes they would just not show up because they were in the middle of a PlayStation basketball tournament and with their team or whatever. And so they just, oh, well, I make millions of dollars, so I'm just going to skip my $700 appointment. We still got paid, but it was just like, you're not going to get better. You're not taking this seriously with your care. And around about that time was my roommate, who was a few years ahead of me in chiropractic school. She started the pediatric club on campus. And so because I was her roommate, had to go to her first meeting for it, the pediatrics club, and because she needed butts in seats, and I was there, and I had to go. Okay. And so I was already, this cool guy that was going to be working with pro athletes, and I'm sitting there, and there's this one doctor that came in who was talking about his practice and how he works with babies. And I just remember vividly this one story he told of this baby that came in who was gray, had been diagnosed failure to thrive, couldn't eat any formula, couldn't breastfeed, was throwing everything up. They were about to go insert a tube so that they would start tube feeding this baby. And It was super sad. They came in basically because they had tried everything else and they just wanted to see what chiropractic would do. And the way he tells this story, he came in, did his exam, he did a very gentle adjustment. He had a misalignment right where his head connects to his neck. And that's a super important area of the body. It controls all of the things that keep you alive. So your breathing, your muscle tone, all of these things. And he said it was out, maybe because of the birth process. Maybe somebody, I don't know the history of that baby, but I imagine it was a rough birth. And so then that became misaligned and put interference into this baby's nervous system where they couldn't function at 100%. And so much so that they couldn't eat very well. He adjusted this baby and he said, on the table right there, that baby went from gray to pink.
Wow.
And and he said, okay, well, let's see how we're latching now. Baby immediately latched and fed for the first time. And I don't know exactly how old this baby was. I imagine it was a couple of months, or maybe a month, something like that. And baby had latched for the first time. And from there, I was like blown away. I was over here taping ankles and, rubbing on calves of these pro bowlers, which I thought was super cool. But this was life changing.
Yes.
This was something different than cool. This was like important. This was meaningful. And I continued working because I got paid to do this job, right? I continued working with these athletes, but my intentions and goals completely shifted in my head. I stopped going to the sports chiropractic clubs and started going to the pediatrics chiropractic clubs and worked, my way up into being the president of that club and running pediatric seminars in school because I'd consumed all of the information that the school had and that the training that was available. So we started actually flying in extra professors to teach from around the world, just to teach me and my group so that we could be the best at it. So that's kind of my why pediatrics in pregnancy is because it's just so meaningful.
I mean, I think that is really, really great. That story about when you were in school. My story is kind of similar. I kind of found pelvic health in school. So I think that the fact that we both kind of knew our passions kind of early on is really awesome. So I want to kind of dive a little bit deeper into specifically with pregnancy,
Yeah.
and in that early postpartum period. How do you feel chiropractic care is beneficial for the mom who, say, is in her first trimester, or is in late term pregnancy?
So, kind of just segueing from what I was already talking about, my main passion when I opened the practice was babies. Save the babies, help the babies, help the babies, help the babies. But then we started looking at what is the main reason why we're having to help all of these babies. And just like that doctor that was telling us that story, I've had so many of those exact same stories come through our office. And it's awesome. I love coming to work every day. But that segue is that rough birth process. And it doesn't even have to be a rough birth process because birth, as most people know, isn't, butterflies and rainbows most of the time, or if, you know, anytime. Uh, it's it's a serious thing and it's a wonderful thing, but it is stressful on mom and baby's body. And so that's where we started, or I started, really looking at how do we help this birth process go as easily and as smoothly as we can to help take that tension and stress off of mom's body during birth and off of baby's body during birth. And so I would say the biggest controllable thing during birth, because anything can happen during birth unexpectedly, but the biggest thing is that preparation. And you and I both know that that's true, is there are distinct differences that we see clinically in general with somebody who just shows up for birth or somebody who's been really on a path of trying to own their birth and make their birth happen the way that they want. And this isn't to say that there's one right way or anything like that, but really in that pregnancy, especially early pregnancy, is really important to take the time to take care of your body with pelvic PT and with chiropractic because sometimes it takes a little while to get your body into the proper space where it can have that best birth outcome. We see a lot of women that come in because they're 38, 39 weeks and their sciatic pain hurts so bad that they can't walk anymore and they're scared to give birth with this pain. And at that point, we can definitely help with some of that pain and function, and a lot of times have really good success with that. But really, it to really get to the crux of the issue, we have to start before, even before pregnancy, really. But it definitely, when you find out you're pregnant, it's time to really kick it into gear, taking care of your body. Just one thing, the studies um, show that the birth process is about 24% shorter with the first time births, singleton births under chiropractic care. So about 24% shorter labors with women that are under chiropractic care versus not.
That is absolutely amazing. And if you ask a pregnant mama who's about to give birth, would you like for it to be 24% shorter? I'm sure a lot of people are like, oh, please give me that slightly shorter labor. I would love that 24.
Yeah.
That's huge. That's
Mhm.
huge. And just to tie it back in with the pelvic floor, we also are so concerned with making sure that labor isn't too long because we know that the longer labor is, the longer that pushing phase is, the more opportunity we have for pelvic floor damage and dysfunction. So that is one of those reasons why, as soon as I start with a mama, and I love to start again in that first trimester, one of my first questions is, who is your chiropractor? Because, like you said, it takes starting early to really get to the root of whatever type of misalignment has happened prior to pregnancy, right? And so, even if it's a second or a third birth, we know that there may have been things that have happened and changed since your last birth. Maybe you've been in a car accident since your last birth or had a really bad fall. And these are all things that can absolutely impact.
You've given birth since then.
Exactly. That's a very good point. That is a very, very good point. Yes. And so that's interesting. That goes right into like my next question, which was, how do you see chiropractic care complementing pelvic floor PT?
So I see these two things intertwined completely. And because the body is super complex. The body is so smart. Um, and just even to tie in what you were talking about with these extra stressors, I even will say to a lot of people, your body might have been like this since you fell off your bike at 10 years old. Hit the ground, your butt hurt a little bit, but, you shook it off, and it stopped hurting after, half an hour. But really, that pelvis shifted just a little bit. And your body is so smart that it says, ooh, that could potentially lead to damage. So I'm going to lock it down because no motion is better for me than damage.
Absolutely.
And so what happens is because your body's so smart, it locks that down. It locks it down for 20 years. And you don't really feel much pain. And then what happens is you get pregnant. And then that relaxin, that hormone that destabilizes everything. So your body was super smart, it locked everything down, and now it's releasing. And now you get, 10 weeks into pregnancy and you feel like you got hit by a bus, but baby is only the size of a kumquat. So it's not baby pushing on anything. It's your body just becomes unstable. And so really to get your body back to stability, we need our frame to be moving properly. We need our nervous system, which is where really the main component of what I'm doing is neurological control. If you think about it like a little marionette, like the little puppet on the string, we want to make sure that our nervous system is pulling those strings balanced versus off balance. Then from there, that frame, that neurology, that allows for the muscles to be more balanced tone. And then that's where pelvic, and so you're the expert on the pelvic PT, so you have to take it away from here. But from there, that is my contribution is to helping the neurological balance um, happen. And
Yes.
so then you can complement that, and I'm sure that you can explain much better from there.
Absolutely, absolutely. I mean, and I talk to so many of my patients about that, that if we don't have that a good foundation, if we don't have good alignment, if we don't have good stability in the pelvis and really through the entire spine, it's going to affect the muscles, it's going to affect the ligaments, it's going to affect how you walk, posture, which is all going to affect how baby's positioned, and we can see just clearly how the positioning of baby affects everything from how long labor lasts to any type of pelvic floor trauma and stuff like that. So I think that pelvic PT and chiropractic care, it just complements each other so well for a holistic, I always preach the team.
And we've talked about this multiple times. Is our patients our people? I like to call them my people.
Yeah,
Um, when they come in and they're seeing both of us, their results are just exponential,
yeah,
and because they're taking care of their body more wholly. And
yeah.
then you add in, making sure that they're walking and making sure that they're exercising and eating right and all of the other components as well. It all goes back to that big controllable is taking care of yourself and not just showing up that day. I think it's super important.
Absolutely, absolutely. And I love our birth community, and I love how many of us are here to support the moms of Savannah and the surrounding areas, to really have, again, that holistic game plan, because it takes all of it. Like you said, it takes the nutrition, it takes, exercise, and it takes the complementary therapies as well. So I want to kind of shift gears a little bit, because I know how much you do for pregnant mamas, because I send you so many and we work with so many people together. Let's talk more about what you do for babies, for kids, for families. I think what I love so much, and that's why I love being in the office with you, is I see full families. I see mama, daddy, the kids, everyone taking care, like you said, of their neurological and spinal health. And if you can talk to how that helps the family as a whole.
Well, it can even come back to just that first story I was talking about, of that little baby that was gray and just not having a good time. Well, if you have a baby, and we even have a patient that just came in um, a month ago, and she started under care, and she said after maybe three or so visits, she said, I'm trying to think of how she said it, but essentially it was to the tune of I can I can actually enjoy my baby now. And even if we haven't had a baby before, I'm sure we can understand that having a baby that's uncomfortable, that is crying nonstop, that isn't sleeping, that isn't eating well, biting your nipples, or rubbing your nipples because their jaw is not working properly, that's just not a good phase in your life. We can say that. Like it's horrible, or it can be horrible. On top of that, a lot of people are already have signs predisposed to postpartum mood and anxiety disorders, depression and whatnot. On top of you get, 0 hours of sleep a day. Dad's getting 0 hours of sleep a day. Mom's body's hurting. You're trying to recover. You have these hormones going everywhere. And so what we're doing is coming in first before we even touch anybody. It's hope. It's, hey, you're right. This is not how this is supposed to be. Babies shouldn't just be crying all the time. That's not normal. They should cry when they need something. That's it. And so figuring out what that is super important. But if they're fed, they're changed, they're clean, they've been outside, you've given them a bath, you've done all the things that you think they can do, and they just won't stop crying, then we say, listen, I get it, because they are told from other places, oh, that's just how babies are. And no, it's not. And so immediately the stress level hormones come down. Then we start adjusting baby, and baby stops crying all the time. Then we start adjusting mom. Hopefully, we've been adjusting mom throughout pregnancy. But if not, we start adjusting mom and allowing mom's stress levels to come down. She can start recovering better. And then usually it's in that order. It's mom starts under pregnancy, and then baby starts. And then dad, after mom and baby are under care and are telling dad about, the results, then dad starts coming in. And it's just so awesome to see, and then brothers and sisters and all that, and having the whole family in, and they're just able to really, I don't know, just function at a more comfortable level, a safer level. Their body just doesn't have this fight or flight mode as much anymore because their body is functioning so well.
That's amazing. That is really, really amazing. So, the next question, I don't want to put you on the spot if you can't think of anything, but do you have any funny or memorable stories from your practice that you'd like to share?
Um, let's see, funny or memorable. So a lot of my memorable stories are kind of deep and impactful. And so I love those. We had a baby come in. It was a mom. She was been under care for a while. She had a baby. She came in and brought her baby in to get checked postpartum so to help baby recover from birth. There wasn't really any issues going on with baby, but we all know that birth is stressful, so she wanted baby to get checked. And she went to 41 weeks. And I remember seeing her at 40, 41 weeks, uh, pregnant in the office. And then I saw her, 2 weeks later with baby. And I made the joke. Uh, what was the joke? It was, oh yeah, your 50 week your labor. It came out naturally. We're talking about how it waited a long time, or and oh, your 50 week pregnancy. And I stopped to think about it that they had had two or three miscarriages over the last 2 years, and then they started under care. They started working with a nutritionist. They started working with a functional medicine doc, got pregnant, had baby. And so really it wasn't 50 weeks like I was joking about. It was 2 years they were waiting on this baby. And so it was just everybody we went from joking to like everybody looking at each other. And so I said it. I was like, no, it's been about 2 years, not 50 weeks. And dad looked down, hugged baby, and it was just like a realization that I guess maybe they hadn't had yet. And it was really cool and heartfelt. It was awesome. And then as far as funny, I mean, these kids we see in here running around, they're always doing something. I get the other day I had to I think I was even wearing this shirt. I was holding baby while mom was getting adjusted, and baby just all over
Oh,
my shoulder and down my back. And so, I mean, it's funny. I've been pooped on a ton of times,
I'm
spit
sure.
up on, and so that's always pretty funny in here.
Yeah. Oh, I love that. I love that. And I loved your heartfelt story because we both kind of work in the fertility space, and I love the patients that I have that have seen you and have said that they, were at a certain point in their fertility journey, and then they, really started to focus on their balance, on their spinal health, and really getting under chiropractic care, and how many babies have really come from that. It's just amazing.
I don't talk about it a ton. I need to talk about it a
No,
lot more.
I
Um,
know.
but and I say it's really about the body. It's not about me or the practice or what we do. It's about their body being so smart. But with the protocols that we put in for these families under I call it preconception. I don't call it fertility, infertility, preconception. Um, for me, because it's a mindset shift. The protocol we put these families on during preconception has enormously high results. And you don't have to take a bunch of hormones and spend $75,000. And it really helps a ton to just get your body back in proper balance.
Yes, that is amazing. That is amazing. So I don't want to take up too much more of your time, but
Sure.
I did want to talk about something exciting. I know you have some news, so I'll let you share it.
Sure. Yeah, we're expanding. So I have been, working my butt off for the last 8 years, and it's come to a point where we have just hired on two new doctors who are awesome. They are really focused in what they do, just like I am. And so with the all the way from the preconception phase through pregnancy, Webster certified. I'm sure most of the people that are watching this understand Webster certification. If you're pregnant, you need to be seen by a Webster certified chiropractor. And then Webster certified for helping women give birth much more efficiently and easily, and then in that neurodevelopment period where we're recovering from birth and that first year up through, school and through adults, really, development never stops. I'm still kind of developing. Um, and so, yeah, we're super happy that they're here and they're having great results. And we're going to be expanding hours very soon, and it's going to be amazing.
That is so awesome. I'm so excited for your practice. I've met both doctors. They're both fantastic, and I've, heard really, really great feedback from patients. So I'm just I'm so happy because we need more support in the Savannah area. That's what I hear most consistently from my patients is we need more of you. We need more chiropractors that specialize in pregnancy and babies. So I'm so happy that we're now able to broaden our reach and be able to reach even more families. And that is really what it's all about.
It is. It is.
Awesome, awesome. Well, thank you so much, Dr. Caleb. I appreciate you doing this community spotlight for me. Do you want to shout out any information, anything upcoming? I will, of course, have all of your info linked. Um,
Yeah, for sure. So we took a little bit of a break, but we are starting back our Saturday meetups, and we're going to be going from office to office. I'm telling you right now that we'll be taking over your office, Bloomingdale. But we're going to be doing baby wearing and courses and classes again starting in August, and and it's going to be awesome whenever it's not so hot outside. Well, I guess it will be hot in August, but um, But
Well, we
yeah,
kind of
so
past the vacation phase for
yeah.
most people,
Mhm.
so like it kind of get through July, and so yeah, so excited. We have so much coming up for the birth community, and I want to thank you so much for taking the time to do this.
Thank you so much. Thanks for having me.
Okay, you're welcome. I'll see you later.
Yeah.
Bye.